Hello everyone. Hallux valgus is one of the most common deformities of the forefoot, especially in the case of the females. And it has been over the period of time, this actually incidence has increased over the last few years. Hallux valgus is a problem of the first ray. It's a complex issue and it's not just isolated problem of the first metatarsal head. Hallux stands for the big toe. When we talk about hallux, it's always related to the problems or pathologies or issues of the big toe. And valgus means away from the midline. Anything which goes away from the midline is termed as valgus, and anything which goes towards the midline is termed as varus. If you see this diagram, there are two pathologies which are actually occurring. This is the proximal phalanx and this is the distal phalanx, and then this is the metatarsal ray as well as the head of the first metatarsal. The proximal and distal phalanx are actually going away from the midline, as this would be the midline over here, and metatarsal head and metatarsal bone is going towards the midline. So it's actually a complex issue in which the distal part where the phalanges go away from the midline, that is termed as valgus, while the metatarsal head and the metatarsal itself, first metatarsal, goes into the plantar flexion as towards the midline and in the varus position. It's actually a progressive deformity. It's not an isolated problem. There are multiple muscles which are actually acting, and their net effect of the forces actually results in a normal first ray. What happens is that first metatarsal goes into a plantar flexion, pronation, as well as the medial deviation. And why this happens? Because there are multiple muscles which are actually acting. For example, muscles like adductor hallucis, which is pulling it towards the laterally. Then there are muscles such as extensor hallucis longus, which once this progress starts to progress, eventually enters into a vicious cycle that initially it's only the adductor hallucis, but then extensor hallucis also starts to pull it, and eventually the whole phalanges, the sesamoid, they are lateralized, and the first metatarsal goes into a varus position and assumes a more plantar flex position. Now this results in a functional disability and foot pain called as transverse metatarsalgia. Why this happens? Because the weight of the body is being transferred to the first ray, but once this kinematics is actually disturbed and whole of the sesamoid bone actually lateralized, the main for transfer of the weight is actually going through the foot in the second metatarsal, and second metatarsal is not strong enough to actually bear weight, leading to transverse metatarsalgia as well as the fractures, stress fractures of the second metatarsal. And these all due to the pathology which is not at the second metatarsal but at the hallux valgus or the first metatarsal head. Now there are two forms of hallux valgus. They are briefly defined as, one is called as the juvenile form or adolescent form, that is the hallux valgus, which is usually seen in young adults or even in the children. As we'll continue and we'll see that how much genetic predisposition actually plays a role in juvenile adolescent form as well. And then there is an adult form which is usually seen especially in females and mainly related to actually the ill-fitting or wearing shoes over the prolonged period of time, especially with the confined toe box or a very narrow toe box. Especially with these kind of situation, there is a chance of development of adult hallux valgus.